The physical packaging and labelling of pharmaceuticals isn't dissimilar to packaging and labelling many other products, the nearest probably being food and beverages. With pharmaceuticals, however, the consequences of getting it wrong are severe. It isn't just that taking the wrong drug won't improve the patient's condition. It could, in some cases, worsen the condition, or even kill the patient. The same goes for taking the wrong dosage. An overdose of some drugs can be lethal. So, control over packaging and labelling is something that checks printed material checks, etc. We should look at the control of any other printed information applied to the labels or containers locally, such as embossing the expiry date and batch numbers on tube crimps, and on or offline printing of the same information on labels. Identification of the unit containers is not the only complexity in packaging and labelling. Each unit container, called primary packaging, or a multiple of them, is normally packed into a secondary package, a box that also has to be identified, or a recall, especially if the date stamped is further into the future than the stability data would support. Finally, there's a risk of mix-ups in packaging, for which there are numerous possibilities. For example, correctly identified product in correctly identified carton with wrong leaflet. Correctly identified product or wrongly identified carton with correctly identified leaflet. How about the correctly identified product in correctly identified carton with correctly identified leaflet in wrongly spill? Then personnel are not carrying traces on their clothing home to their families. As far as personal hygiene is concerned, we might tolerate a standard of cleanliness somewhat less than that of manufacturing, but greater than that of warehousing. Possibly the best solution is to ensure that standards documented in appropriate SOPs are similar whichever the area, but vary only in the actual apparel and accessory regime needed for that area. With cellulose, no evident signs of dirt or product spillage. And of course, the building and its finishes should be in a good state of repair and kept clean and neat with high standards of housekeeping at all times. If mix-ups are to be avoided, the packing area has to be big enough and laid out so that the packing lines for different products are separated one from the other, usually with partitions. Each packing line should be identified with respect to its status. If it's running, the name and batch numbers of the product being filled should be a procedure, and records on hand to show that this is done at the beginning of packing every different product. Ask if any cut labels are used, and if there's any offline gang printing. Both EU and FDA GMP discourage this type of labelling, and FDA is very explicit about cut labels for which there must be either dedicated lines to each strength of each product or barcode readers to performing 100% examination for correct labelling or 100% visual inspection for correct labelling.